Okay, well, hello, everyone. Thank you so much for joining Protect Our Province BC today, our panel review of the most recent government updates on the rapidly evolving COVID-19 situation. My name is Dr. Karina Zeidler. I am a family physician in Vancouver, speaking to you from the unceded traditional territory of the Musqueam, Squamish, and Tsleil-Waututh Nations. I would like to introduce our panel today. We have Dr. Lynn Filiatro, who is a retired BC emergency physician. Hi, Lynn. Thanks for joining. Jennifer Heighton, who is a community advocate and teacher. Thanks, Jen, for being here today. And Dr. Amy Tan, who is a palliative care and family physician, as well as clinical associate professor, UBC Faculty of Medicine. So thanks, everybody, for being here today. I think we'll just jump into things, starting with, of course, Omicron. What do we know about Omicron at this point? What is it that we would like to share with people? Anybody want to jump in?
I can start. So what we know about this variant is that it's extremely transmissible. And we also know that it evades antibody protection. So with Omicron, right now, fully vaccinated means 3 doses of vaccine. So it is an issue because in BC, as you know, our rollout has been slow for that 3rd dose. And then the other thing that we found out is that because it's so transmissible and infectious, we are seeing our cases expand right now. And the fear is going to be what happens with hospitalization. So maybe I'll stop here and let other people pitch in.
Jen or Amy, anything further to say?
I would like to pitch in that fact that it's looking like there are increased hospitalizations in children with Omicron in places that have had transmission of Omicron a few weeks earlier than BC. So South Africa, the UK is noticing an increase in children with hospitalizations. Even Quebec is saying the same thing. And so I think that this is something that we need to be concerned about. New York State as well. There's more there too. So I think that pronouncing that hospitalization numbers are low at the moment does not take into account the fact that in other places they are seeing increases. And I think that needs to be taken into account, especially because some of the kids are not vaccinated.
Absolutely. Amy?
Yeah, and just kind of jumping in from there. So hospitalizations, we don't know enough. We haven't peaked, and so with hospitals, hospitalization and death being a lagging indicator as well, we can't really say anything. And I think most healthcare workers who are looking at being on service in the next 3 to 4 weeks, myself included, are holding our breath as to like, what are we going to do? Because in BC, we haven't even recovered from Delta. We have increased hospitalizations, not only from Delta patients, but also the backlog of all of the chronic disease management cases that have waited until the very last minute to come into hospital to actually get care. And so hospitals are full of not just COVID patients, hospitals are full of heart attacks and strokes and kidney disease and infections and all the things that us as human beings are all at risk for. With the unprecedented winter snow that a lot of BC is having, that also is impacting hospitalizations. So it's not just COVID hospitalizations that we need to keep an eye on. It's the fact that our entire system continues to be overburdened and overstretched and short-staffed. And I'm going to say short on morale right now in terms of healthcare workers and how burnt out we all are. The other thing I want to say about Omicron is we don't know what the long-term effects are. I saw a tweet yesterday that said, we've known about Omicron for less than 6 weeks. So for people to say, oh, it's mild and there's no long-term effects when we know it causes blood clots, and it causes neurological effects, and it affects people's hearts and lungs and guts. I think we can't say right now that what mild means, because we just don't have enough data. So let's do everything we can to be cautious and proactive.
Yeah, let me just add to that. So I think it speaks volume that we have to be careful when we're comparing ourselves to other countries. We saw that with South Africa. Their population average age was something like 27 years old. That's not the population age in BC. The percentage of vaccination in the population overall in South Africa was 25%. But a huge percentage, I think the number is close to 75%, had already been infected. So it's not quite the same comparing what's happening in South Africa with what is happening here. The one thing that I think we can learn from South Africa is that 20%, if not more, of their workers ended up getting infected or needing to go their healthcare worker needed to be isolated. So we see this already starting to happen right now in all sorts of industries, and it's going to happen in healthcare as well.
Absolutely. That's a good point, Lynn. When we compare ourselves to other places that are a bit more similar, so Denmark is a good example there in terms of population size, as well as vaccine status, although they're quite a bit further ahead of us when it comes to boosting their population. We have, been seeing increases in hospitalizations there. Also, again, in Quebec, Ontario, France is showing increased hospitalizations. And so I think the idea is we want to look forward at those places and prepare now for what might be coming. And so when we're thinking about that, we need to take into consideration Omicron, the virus itself. We know that it is much, much more transmissible. It does seem like it is causing less severe disease in terms of what we're observing, but because the numbers, of course, are so huge in terms of the cases, that is going to still lead to quite a bit of an increase in hospitalizations. Anything else that we can talk about? So we've talked a bit about Omicron itself. Now, when we're looking at BC, the people in BC, our vaccine status here, what do folks think in terms of people here in BC and how we might respond to Omicron?
Well, I think just to get back, I don't want people to get the wrong impression, because sometimes you hear the word, Omicron is mild. Let's be clear, as people that are double vaccinated, right now, you are more at risk of getting infected. You're more at risk of developing long COVID. And because you're more at risk of infection, you are more likely to end up in the hospital and needing ICU than you were with Delta. Yes, the vaccine seems to provide us with cellular immunity, but as an individual looking at your risk now versus where you were in September, if you were double vax, your risk is higher. So we need to be very careful about it's mild. And then also as an individual double vax, you are now likely to infect others. So it means anybody in your household that hasn't been vaccinated yet because they're not eligible. So you become basically a vector to transmit to others. So I think people have to be mindful of that. It's a big difference compared to where we were with Delta.
No, absolutely. Anybody, Amy or Jen, anything else to add there?
Well, I think going to the vaccination as well, I think we need to get the word out that the 5 to 11s are eligible for their first doses. And on last count, BC had about 35% of eligible 5 to 11-year-olds in BC vaccinated. And so, I'm going to use this opportunity to say to parents, please get your children vaccinated, because right now it looks like for age 16 and under, it's 2 doses, but there is some recent word from the US that the FDA is approving the boosters for 12 to 15-year-olds. So we do need to get first, second doses for sure for 5 to 11s. I suspect down the road there will be a third dose, but please let's get this vaccination going for our children. It will make our schools safer, it will make our community safer, and it will allow our kids down the road to have a little bit more freedom to interact, which we know is so important for their development.
To add to the children vaccinating, I think one way to actually help with that would be to have vaccine clinics in schools. And so collect permission forms ahead of time from parents, send a nurse on a certain day. They can do the whole school within a few hours, and those that have permission, they would get their first dose. I think that would really help, because trying to get to vaccination clinics has been a challenge for some families. This would be really, really helpful if the province were to, use what they've done before, like in a grade 6 vaccination program that we do every year. The nurses come in and visit the school. This can be done on a widespread approach for this Omicron as well.
That's right. And I think at last count, Jen, there was only about 37.5% of kids 5 to 11 who had received their first dose. So that's still a lot of kids who are susceptible. And I think also going back to Lynn's point about how your risk of getting infected now with COVID, the Omicron variant, is much higher than it was previous in terms of the risk of getting Delta. So if you just compare Omicron and Delta, that's one thing. But if you compare your situation now to your situation a few months ago, that's where the risk is different. And I think with our government right now, what we've been hearing from them is that they are not interested in decreasing transmission rate in the community. Their focus is very much on decreasing, trying to keep hospitalization numbers down. And so what that means is that there are not any mitigation strategies right now to help us not get COVID. And I think that is a big issue, especially given how little we know about COVID. And it is not an inevitability that we just all get COVID. There are things that we can do to prevent mass infection in our population. Did we want to talk a little bit maybe about the booster program as well, since we touched on vaccinations in kids?
Well, I just want to touch on what you just said. So the government has put some policies and procedures in place right now to decrease transmission in the community. But let's be clear, those policies are still based on the wrong mode of transmission. To allow people to go and gather in restaurant, even at 50% capacity, when you know that the virus is transmitted through shared air, means that people are very high risk of getting infected when they remove their mask, or even if they go in an indoor setting without removing their mask, if they have a poor quality, poor fitted mask. And that is a message that really needs to be shared and shouted, is that you're going to get infected by sharing other people's air. So the mitigations we have with decreased capacity in large venues or in restaurants are not adequate to prevent transmission through aerosol. And that's what we're seeing, is that people are getting infected. The unfortunate thing now is you're not going to hear about it because we don't have contact tracing.
Jen or Anna, anything to add there?
I think further to that, it's one thing to say we're not trying to actively decrease community transmission, and we're really looking at hospitalizations and ICUs, regardless of what is said about how mild it is. But I think we have a collective responsibility to take care of the people society makes vulnerable, locally and globally. And I think, what about the essential workers that have to be face-to-face with hundreds of people? And if you don't have airborne precautions and you don't have N95s for your cashiers and your front line staff who are day in and day out exposed to the public and having to argue with people to wear a floppy mask that's not going to protect anybody. Like, what are we doing with that with regards to those who are underpaid, underprotected, precariously employed, likely doesn't have paid sick leave? We're not taking care of the people that public health and the government should be taking care of. And this is, you know, I think what we're losing sight of as Canadians is, let's not, you know, forget that we do usually espoused to be taking care of our neighbors. And I feel like during this pandemic, we have fallen greatly short of that. And so we do have a responsibility to decrease transmission. We do have a responsibility globally as global citizens to decrease transmission, because the low middle income countries are not vaccinated. They don't even have first doses. And we're talking about third doses, and some high income countries are talking about fourth doses. And we have many countries in the world who don't even have one dose. Let's use our voices to talk about vaccine inequity to achieve equity, but also, don't we have a responsibility as privileged countries in the Western world to be saying, you know what, we're going to do our part. We have the privilege of 3 doses. We can still go and have some semblance of being able to interact outside and get takeout, etc. Why are we not doing our part to decrease transmission so that variants cannot be continually reproduced? Because we're never going to get out of this until the whole world is actually taken care of.
I think that's a super important point. You know, recognizing those parts of the world that don't have the same protections and the same amount that we have had so quickly, and letting it burn through our population just because we've got 2 and 3 doses doesn't mean that we should be letting it happen. And the thing that brings, you know, relates back to schools is the fact that the children have only just started to get their first doses. And so, you know, thinking about that, okay, if it was the 30 to 50-year-old segment of the population that only had just started getting their first doses, would these decisions be being made right now to let it burn, to let it rip? The fact that they're going to let it rip through the population when not everybody has had the advantage of getting dosed to the amount that really would protect them is irresponsible, because these children, not even 40% have 1 dose, only 1 dose, let alone 2 dose. That they haven't had a chance to get that far yet is not right. So this whole endemic, oh, it's okay, everyone's going to get it, is saying to this segment of the population, you don't matter. And the 0 to 4-year-olds as well. There are lots of families who are worried sick about their toddlers, and I don't blame them. And what about the essential workers who go to work and have a toddler at home? They can't distance themselves from those children. So, you know, they are worried about passing it on to their own children at home.
And then there's also, you know, the very immunocompromised, or those with disabilities that we know have, again, been disproportionately affected by all of COVID in terms of the infection risk, and the policies haven't taken them into account as well. We don't know when we walk into a restaurant and take our mask off who is around us, but also the fact that we're all interconnected. So it might be your server has an immunocompromised person in their home that they're now going to be exposed to and creating a risk. And this is the thing, is we really need to be looking at this from a community, bigger than community, but we need to be looking at this. It's not just about individuals. We're all actually really interconnected. And we're talking about protecting our kids, and, you know, they're the most vulnerable, I would argue, right now because of the lack of vaccines and because they go to school. But why are we not doing everything we can, even from a school perspective, to make schools as safe as possible? From mitigation of airborne, ventilation, HVAC, getting boosters to teachers, or I'm actually going to call it 3rd doses to teachers, getting a very, very directed campaign to the children. But on top of that, why are we saying, we're going to delay opening schools for a week just to see where things are, and potentially it could be longer. But then we're allowing, people to eat in restaurants and go to Canucks games. Like, it just, what are our priorities in society these days?
No, absolutely. And just to clarify my statement from previous about the current measures not being to decrease people getting infecting. They are going to decrease people getting infecting, but the goal is to decrease people getting infecting so that our hospitals are not overwhelmed, versus the goal being decreases infection for the overall health of our population long term. And we know that our hospital systems right now are just at the brink of collapse. Lots of stories about, only a single nurse for a ward of 30 patients on her own, places that are not able to provide services because they don't have the staffing, and so on. And I'd like to bring up the point also with the N95 masks, because earlier today, Dr. Henry responded to one of the questions in terms of why healthcare providers are not being supplied with N95 masks, for example, for vaccine clinics. And the idea there being that it's a controlled environment. But we know that up to 50% of transmission can happen when people don't have any symptoms. And there have been people who have posted CO2 levels, so people breathe out CO2. And so if it's a not well ventilated space, you're going to see increases in CO2. And you have people who have posted they have CO2 monitors, they go into their vaccine clinics, and those levels are much higher than the 800 parts per million, which is considered the safe amount. So what could possibly be the downside of providing people, healthcare workers, or just anybody in society, with good, adequate masks when we have this level of transmission in our communities? So I think everybody absolutely should be provided with an N95 mask. And then the other thing was, we brought up, of course, schools. Maybe we want to talk a little bit then about what the enhanced safety measures were that they discussed, that they're delaying schools a week for, in order to be able to implement. Jen, did you want to tell us a little bit about that, especially from your perspective as a teacher?
I'll make it quick, just because I'm aware of time here. The advanced safety measures are not advanced enough. We need to talk about they need to be implementing ventilation improvements in the airborne transmission, the N95 masks, the HEPA filters. Without it, there's going to be spread, and there's going to be an illness everywhere, and that's going to affect everything. Families will have to stay home and not work because their kids are sick. Staff will be affected, and possibly schools will shut down because there won't be enough staff to man them. And so, there needs to be a better approach. And I think that's what we're going to be getting to next, is what should the province be doing? So, besides just 1 week of setting a few things in place, there's ways to deal with this that will help reduce transmission and make it a lot better for everyone, including families. Because I know for next week, even just the families not being able to send their kids to school, but then the families need to work. What do? There needs to be more in place, and I think we'll be getting to that part.
Just to add to that, it's going back to basic principles. And, I sound like a broken record, but until we address that the virus is spread through aerosols, not just through the air, through aerosols, none of the measures we're going to be putting in place, be it in schools or long-term care or hospitals, are going to be enough. And we also need to go back to precautionary principle. We have a variant that is really starting bushfires everywhere. And as soon as it gets in, it's just going to ramp through facilities. So if we look at long-term care, it's already started here. And again, we knew this was coming. Why did we not take a precautionary approach and from the start saying, don't let it come in. Put measures in place to address aerosol spread, address ventilation and air filtration. And the same thing goes for school. We need to avoid it coming into the school because it's just going to rip. So really, it's going back to baseline or basic principles that this province still doesn't seem to get.
And so what, as a group, Protect Our Province, we have put forward the idea that in response to what is going on, we recommend that there be an at least 3-week circuit breaker. Perhaps we can discuss that recommendation unless anybody has any other points before we jump into that.
So in terms of schools, a 3-week circuit breaker would be vastly advantageous for families because then they could access federal supports. There are federal supports in place that if a province does declare a closure, that families can access supports for having to stay home with their child and support their remote learning. Now, the whole point of a 3-week circuit breaker would be to reduce community transmission. And we know that community transmission is so high right now that testing centers are overwhelmed and the true case counts that are being reported by the province are not accurate. So a 3-week circuit breaker would allow for people to access the federal supports, including family ones, in particular for school-age children and for daycare, kids in daycare, but also for businesses. And I think I'll let our other participants here talk about how a 3-week circuit breaker would also be useful, not only for schools, but for businesses as well.
Yeah, I think what's becoming clear is that we've seen it with airlines, possibly BC Ferry this week. Every single industry is going to be impacted by anywhere from 20 to 30% workers being down, be it because they need to isolate or they're sick. And by the time they know that they've acquired Omicron, they've passed it on to their colleagues at work who have passed it on and so forth. So the only way we're going to stem the tide in terms of Omicron is going to be with a circuit breaker. And that's with the goal of decreasing transmission in the community, which will also decrease the impact on our healthcare, allow us down the road to open safely for schools and whatnot. So I think everybody's going to be impacted, and we're seeing that now.
And just looking at what Quebec has declared as of tonight, or in a few hours, I think that's the inevitable thing, is that whether or not, nobody wants to have to close things down, but this is the virus doing its thing and not negotiating. It's not sentient. So I think, we need to be looking at the fact that without an official closure, none of the businesses and individuals can access those federal benefits that were just announced. And so we need to allow this to be tapped into. Just a lot, because if we don't actually declare it, they can't get the benefits. But we know that this is going to happen anyways, just because people are going to be off sick and every industry is going to be affected. So why don't we just rip off the Band-Aid in one swoop and have all of us collectively doing what is needed right now, rather than it be dragging on, causing chaos and causing further hardship at the local level, not being able to, help families and businesses stay solvent because they don't have those benefits.
I just want to add to that, is to say, if we lock down now, we have the opportunity to ramp up third dose as well during that time frame, and also really reach out to parents, because we know For example, in the North, 21% only of the 5 to 11 have had their vaccination. So really now that buys us time to get as many people as possible to get their third dose, and therefore protected from infection and all the negative consequences.
And
And I think it's,
oh,
sorry, I just wanted to add that I think it's very important to know that this lockdown or circuit breaker could have been avoided. That we are only recommending that this happen now because of the failure of public health to be able to proactively manage our Omicron wave. So as a group, starting a month ago, we were putting calls to the government to ramp up rapid tests as a surveillance, not as diagnostic as they're using now. Of course, they went on and on about how they didn't have tests. It was too complicated to use the tests. People were not able to use the tests at home, and then now they're being handed out at testing sites to do that in order to diagnose COVID. When really a rapid test is best used as a surveillance method, meaning you try and see whether or not you're infectious with COVID versus whether or not you have COVID. So that is something that they could have done, a month ago to help decrease transmission. They could have been ramping up their boosters, back then as well. They could have been addressing COVID as airborne, putting in recommendations for high quality masks, all of the stuff that our group has been calling for this whole time. So it's certainly not with any kind of lightness that we are recommending a circuit breaker. We realize the impact that has on society, but at this point, it's sort of the writing is on the wall. And if we do it sooner and now, then that means that we can do it for a shorter period of time. We can decrease disruption to society. We can decrease illness and disability, and that's where that recommendation is coming from. Any other?
I was going to say we should use that 3 weeks to educate the public about how this virus is spread, about what they can do to help reopen their businesses safely. So open windows and doors more, check your ventilation, buy a carbon dioxide monitor. How do you use a carbon dioxide monitor to make sure you've got enough fresh air in your workspace? All those things could be done in that 3 weeks. And for schools, purchase HEPA filters, HEPA units. Ontario is purchasing a whole bunch. And those things can be done and should be done during that 3 week time. It's not just saying, okay, everybody go home, kids go to remote learning, and that's it for 3 weeks. No, there should be things done in place so that when the 3 week period is up, we can reopen safely so that there's less transmission going on once we start reintegrating back into society.
Yes, and we have a question from the media, Alisa Touveau. Sorry if I butchered your name there. And the question is, do you have a response to Dr. Henry saying vaccination centers are not high risk and N95 masks are not required there? We did touch upon this a bit earlier, but anybody want to take a go at this one again?
I can. I think that vaccination centers have the potential to be high risk for many reasons, and that N95s should be given to every healthcare worker who is volunteering, in addition to their clinical duties, to take on vaccination duties as well in these extraordinary times. I think that because they're not going to be in hospitals, ventilation is going to be questionable. We already have CO2 monitor readings from other places that show that while 800 and less is a good proxy for how much things are lingering in the air, vaccination clinics and pharmacy clinics have been much higher in closed spaces. The other thing is, if you have a lot of clinicians who are vaccinating and one person gets sick, we're all going to be affected. And so, this question of we need to protect our healthcare workforce and potentially decrease our isolation, so that our isolation timeframe, so that we can get workers back to hospital floors. Why are we not doing everything we can to protect proactively our healthcare workers? Why are we not giving them all N95s so that they can, anytime they're in contact with any patient, it's high risk right now because of how Omicron behaves, because of how it spreads asymptomatically, because of the fact that people are not even noticing their very cold-like mild symptoms for a day or so, and they're out there. So I think there's lots of reasons why we need the N95s for the vaccinators. We know that healthcare workers want to help, but they want to stay safe. And it's not a selfish thing. They want to stay safe so they can continue to do our work, because we're looking at January being just unfathomable as to what's going to happen. And so I think it's incumbent on the system to protect us maximally.
I just want to add, it makes no sense that patients or clients come to a vaccination center with a good quality mask, and then we ask them to take it off and give them a medical mask that doesn't fit properly. So the N95, yes, for all workers that are going to spend 12-hour shift, up to 12-hour shift in a vaccination center, which we don't know what the ventilation and the filtration is, but also the people coming into to get their vaccine should be educated and provided a KN95 or a KF95, whatever we have that is higher grade and better fitting.
And Dr. Teresa Tam has said nationally and federally, we all should be presuming that any direct patient care is a risk right now, and that we should all be wearing respirators as healthcare workers, and that Canadians in general should be upgrading their masks to the best possible mask. And so, to actually actively deny N95 access, I think is not even in line with what federally is being recommended.
And I think it's worth mentioning as well that it's not just that N95s are not being supplied to healthcare workers who are working vaccine clinics, but for those healthcare workers who are bringing their own N95 masks, they're being asked to not use those masks and to use the surgical baggy blue masks as well. And part of the reason that has been stated there is because of an equity issue, as since the nursing staff is not being supplied with N95s, we don't want the physician staff wearing them because that would be an equity issue, which really makes no sense whatsoever. And in other provinces in Canada, healthcare workers are being supplied with N95 masks for any clinical situation. So why is it that here in BC, I am going to be less safe at work than my colleagues in other parts of Canada? So really, it should be a national-wide requirement and not have that level of inequity.
And to be clear, we want anybody who is in contact with patients to have access to N95s, be it the housekeepers, be it food services, nurses, OT, PT. It's about any person who is a frontline healthcare worker right now. Mm-hmm. Give it to all of us.
Yeah, and just to add that people are, physicians and nurses are turning down working in vaccine clinic if they are not provided with a respirator. So we may have problems staffing those vaccination centers.
And we do have another question coming up. It'll just be put on the screen here from Stephanie Aitken. What would a circuit breaker look like in terms of post-secondary? I'm totally in favor. Just to note that I know UBC anyhow, but I'm not sure the other universities have said that they are going online until January 24th, which is interesting when we think about the fact that for elementary school, they're only doing a week delay until the 10th, but for our post-secondary, they're delaying return to inpatient by until the 24th. So why that discrepancy? But anybody else want to comment on what would a circuit breaker look like in terms of post-secondary in particular?
Well, just add to your train of thought there. So the post-secondary have access to vaccine, and we're delaying longer versus primary school. They just became eligible for the 5 to 11, and we're just giving 1 week. So again, doesn't make sense.
Amy, look like you're
Yeah.
going to jump in there.
I was just going to say, I think the circuit breaker for post-secondary is actually in line with what I believe UBC and UVic and I think SFU have said in terms of going online until at least January 24th. So I think, there's already precedent for that to be doing asynchronous or synchronous online learning. And that's what a circuit breaker could look like in terms of not having students congregate in lecture halls right now in post-secondary education. In terms of labs, etc. I don't run a university, but there are research labs. We'd have to talk about whether or not there's several people in a lab and what that looks like. And so I think it would be fairly similar to the several other circuit breakers that have happened for post-secondary, where there has been a decrease in people congregating on campus at the same time.
Yeah, and I think another benefit there with the circuit breaker, especially if it was announced now, is that you would not have as much travel with students returning to necessarily to any place across the country that they may be going to school with, but might actually stay at home since they can do their classes online as well. And again, with a circuit breaker, it makes it easier for people because they don't have to make their individual decisions on what to do. It's the same rules for everybody. Non-essential businesses are closed, so you don't have to decide whether or not it's safe to go into a store or not. It makes it easier for businesses as well, in that they don't have to make those individual decisions for them and their workers and their businesses. And so it's in many ways, everyone knows what the rules are in those cases. And I think from a messaging standpoint, it's a lot easier for people to know what's going on.
I'd add that while they're doing the circuit breaker, it behooves the university or the colleges to address ventilation and air filtration, right? And that is the most important thing we could have done at least a year ago. But this province, because of the lead of public health, has refused to acknowledge aerosol transmission, and therefore businesses and universities and long-term care and you name it have not addressed ventilation, air filtration the way it should have been addressed.
And I think it's also worth noting because during the public health briefings, they do mention ventilation often. And it was mentioned on Tuesday by Minister Whiteside that ventilation has been, that they invested $300 million in ventilation for schools. However, we have yet to see any kind of itemization in terms of what that money was spent on. And the little that we have been given shows that a lot of that money was actually spent just on regular maintenance and upgrades versus the changes that actually need to be done in order to prevent transmission from an airborne pathogen within a space. So I think we need to really push to see that there is proper ventilation that has been put in public spaces in order to say yes, we're doing ventilation.
And just to comment on that number of $300 million in ventilation for upgrades for schools, we have not seen that. The latest number really was 87.5 million that they had on the Ministry of Education website. And if they had pumped in another 200 million on top of that, there would have been an announcement of that on top of it. So I don't know where the $300 million came from. And I asked Minister Whiteside to show us the documents that prove that.
I take it you haven't seen those documents yet?
No.
We do have another question coming up in regards to should the interval between first and second vaccine doses for kids aged 5 to 11 be reduced? And that's from Lisa Barrett Chan via Facebook. So right now, the recommended interval is 8 weeks. The Pfizer study for vaccines for this age group actually did have a 3-week interval and not an 8-week interval. That is what they are still doing in the U.S. is following that 3-week interval and not the 8-week interval. The idea, I believe, behind the 8-week interval is that it might give more long-term immunity. However, the risk, of course, is that by extending the interval, more kids get sick during that period. And so certainly I think considering reducing the interval for kids 5 to 11 back to 3 weeks, such as was done in the study, is something that should be seriously considered in order to reduce the number of kids who are going to get infected now. Anybody else have anything to add there?
Yeah, I think you could prioritize the children that have are at risk of severe outcome, and it would make a lot of sense right now with the numbers that we're seeing getting infected to prioritize these children with the shorter interval. And I think the states commented on that. There was a few virologists saying, the kids that were vulnerable, that are getting into trouble, either didn't get vaccinated or didn't get their second dose. And so that would make a lot of sense to look at it from that point of view, I think.
Yeah, I'm part of a Facebook COVID group for pediatricians, and I did throw this question at them to see what they thought, and they unanimously thought that keeping the interval short, given Omicron at this point, would be preferable to a longer interval. Again, just to make sure that you don't have increased infection because of that increased interval. So it's definitely something to consider there. And we have a couple of other questions as well from our Facebook group. So here we have from Larry McDonald: how effective is natural immunity, and should we treat recovered COVID patients like they are vaccinated?
I can take this one on. So the first thing is no, natural immunity from COVID, even with the wild type or the original strain, was found to not have reliable antibody reaction, so that your immunity waned well after 3 months. You were really not considered protected. So there's the fact that you can't rely on how much of an immune response your body may have generated as a result of getting the infection. And we're also seeing with Omicron, it's a different beast, that people who were previously infected with other variants are now getting reinfected with Omicron. So for even more reasons now, even if you have had COVID, please get your full series of vaccinations.
Great. And then we have another question as well. What is your opinion of the province's use of rapid tests as a diagnostic test? Anybody want to take this one on, Lynn?
Yeah, the rapid tests are really for telling you who is infectious. So they answer the question, right now I have no symptoms. I know that 60% of transmission occur in people that are either A or pre-symptomatic. Can I get together with somebody? Okay, and that was why people were trying over the holidays to make a decision, can I see grandma? And really, it's just about, am I infectious now? The problem that we're having with Omicron is that you might do it in the morning to go see grandma, and then in the afternoon to go see another vulnerable friend. You would have to repeat it because the answer you get from each rapid test is just a single picture in time. And with a virus that is so rapidly reproducing, you may not meet the threshold for the rapid test in the morning, And yet in the afternoon, you might be above the threshold and suddenly you're infectious. So it's not meant to be a diagnostic test. And we can see that Nova Scotia, that has rolled out rapid tests way before we did, have learned a lot from the rapid test. To augment their capacity now, they are using rapid tests, but they're giving you 5. Because if you test to find out, oh, do I have the virus, if you want to use the rapid test this way, if you test early with just one time, you might think, oh, I'm fine. And that's what's going to happen in BC. People are going to do a rapid test. They're going to say, oh, fine, I don't have it. Well, in fact, they're just incubating. So giving a single rapid test makes absolutely no sense at this stage. And unfortunately, I would say that the rapid test are going to become very important for healthcare, particularly long-term care. And right now we don't have enough. And this is where we're going to need to focus. And let me add just one thing. Because the UK has been using the rapid test for a long time for, they call it flow to go. I want to go see grandma or I want to get together. I'm going to test. They test both the throat and the nostrils. And we found that increases the pickup. Again, something that we haven't been promoting here in BC.
Yeah, that's right. So there has been some concerns more recently about whether or not how effective or how sensitive, that means how many people you get with the tests from the US, that it may not be quite as sensitive with Omicron. However, by using that strategy of swabbing the throat as well as the nose, that does quite significantly increase that sensitivity. But again, in terms of using it as a diagnostic test, let's say that you develop symptoms, but by the time you decide to go get tested, it's already been a few days, and then you're going to be handed your rapid test and go home. Well, that rapid test might come back negative because you're not quite as infectious, but doesn't mean that you haven't had COVID. And I think long term, especially thinking again about long COVID, which is something that is never brought up during the public health briefings, in terms of, there's currently 4 clinics in BC that deal just with long COVID patients. They're called post-COVID recovery, but just semantics, and they take a really long time to get into. So clearly this is something that is affecting a lot of people here, and I think that it will be useful for people to be able to know and show that they have had COVID by PCR, in terms of them trying to access healthcare services down the road if they do develop some of those long COVID symptoms. So that's another issue there. Amy?
Can I just add about long COVID? I think it's really important that we bring up long COVID because it is the most unspoken about risk. It is what personally concerns me. I live with a disability, and to think about being at risk for something else if I were to get COVID actually keeps me up at night personally. Because we know that the manifestations of long COVID are so varied among people. We don't know until you get COVID if you're going to be one of those unlucky ones. And then if you're one of the unlucky ones to get long COVID, there's people who are in, support groups online, because it's very similar to, other what we call functional illnesses that affects people's quality of life, whether or not they're able to work, disability, how they interact with their families, but there's no test to confirm it. And this is actually probably the hardest part of medicine. As a family doctor, as a palliative care physician, the long-term effects of this could be what actually changes our society in terms of who is able to work and how they interact with families, what they're able to do, but we never talk about it. Because again, the studies have different parameters, and I would say medicine in general has done a very poor job at really prioritizing these nebulous, abstract, very real, but hard to diagnose, hard to pinpoint, and very hard to treat functional disorders that come from post-viral illnesses. And so, people who suffer from chronic fatigue syndrome and other functional disorders will tell you this is the same thing happening over and over and over again. And I'm in the medical system, and I worry about how we are going to support all of the people who are going to be affected. And this might not be life-threatening to them, but it could be very life-changing. And we need to actually recognize that.
And it happens in kids as well.
Mm-hmm.
Yes. Yeah. And there's patients who say, if you've had a concussion, and how we've changed our management of concussion, of how we need to have cognitive rest, and how it impacts, as prolifically as NHL players, for instance. Those are the types of effects that long COVID patients are saying with regards to the neurological effects, that their cognitive status is not back to what it is 2 years later. And it might not be, because we just don't know the long-term impacts of this. Cardiac, lung, there's studies to show that it actually changes the muscle structure in your heart. These are the things that, to be honest, is what I worry about the most.
Amy, I so share your concern there as a family doctor with a fairly large practice. What the long repercussions are going to be twofold. So one is in terms of helping manage people with long COVID symptoms in the short term, but also in the longer term. If you have COVID now, does that increase your chance later in life of having increased cardiovascular disease,
Exactly.
increased diabetes, increased cognitive impairment? We just don't know those things.
Other autoimmune disorders.
Exactly.
Yeah.
And so, in particular with the children, I feel like that is something that is hugely overlooked. And going back to the idea of why it is that we might want to decrease our overall community transmission to avoid not just serious illness, but just infection, that there would be benefit there. Because with long COVID, even people who have mild disease can develop long COVID symptoms. So definitely something that needs to be talked about more. I believe that we have one last question, unless anybody, Lynn, did you want to jump in?
The rapid test, I just saw the clarification about the question. So giving one rapid test is not enough for diagnosis. So that's really the point to hammer, because you might be testing at the point where you haven't hit the threshold. And that's why Nova Scotia is giving five rapid tests for people to test every 24 to 48 hours to diagnose, to use them as diagnosis. And in reality, we're at a stage in the pandemic right now that if you have symptoms, because there's so much prevalence, you should just assume that you have COVID, and the PCR test should be limited to the vulnerable. So over 65, anybody who is at risk of a severe outcome are the people that need to be tested with PCR, because the hope is if something happens, they can access treatment faster. And particularly in the new year, we're going to have access to additional treatments. So it'll be very important to get in the system quickly for people that are at risk of adverse consequence.
Thanks for adding that, Lynn. And so I think we have our last question now. What is your opinion of the province shortening the isolation requirement for 2-dosed people to 5 days only if they are asymptomatic or mildly symptomatic? I can start off with this one just with an initial reaction to it, which is if the public health requirement is to decrease the requirement to 5 days, what that is going to mean in the real world is that even if people are symptomatic at that 5-year mark, that they are going to be asked by work to return to work. And that is the idea behind putting it down from 7 to 5, is to get people back to work sooner because of the massive shortages that we're going to be, because so many people are going to be off sick. So, Dr. Henry today was saying, listen, it's 5 days, but if you're symptomatic or you're still unwell, then you should isolate for longer. But I think the reality with work is that you are going to be asked to return to work on day 6? Are they going to be asking for us to give medical notes to be longer, which is absolutely not what should be happening? I think then it becomes more of a struggle between an employer and an employee in terms of, no, I'm still sick, I need to stay off longer. So that's one reaction to that, but I don't want to hog the whole time. Anybody else want to jump in with further reactions to that?
I haven't seen the data, but again, fully vaccinated for Omicron is 3 doses. So 2 dose, as far as I'm concerned, is you're not fully vaccinated. And the reason why initially for Delta we made a difference is we knew at the time that people that were double dose, they were getting high loads of virus, but for a shorter interval. So they were less likely to transmit. With Omicron, that's not true anymore. People that are double dose are getting infected. And I haven't seen anything to say that because I'm double dosed, vaccinated, I'm not going to spread it for the same amount of time as an unvaccinated. So it's very risky to be doing this. I understand they're following the CDC, but we know the CDC has been wrong in the past about other things. And there are states like Michigan that have said, show us the data before we change anything.
That's right. In California as well, recently added that in order to return to week after that 5-day isolation, that people would have to do a rapid test in that case daily as they return to work. So lots of different responses to the FDA recommendation to decrease to 5 days.
And I'll also say, just from like as a healthcare worker, an essential healthcare worker, why don't healthcare workers and essential workers deserve to rest up and recover fully from COVID? Like, again, there's the human factor in this as well. I get that there's going to be people who are off sick, but that's because of public health measures that haven't contained community transmission. And now to put the pressure and the onus on the individual who is now suffering to feel the pressure from an employer to get back to work, to have to go through the rigmarole perhaps of getting a doctor's note. I think, again, we're putting too much on the individual when really this is about a collective response.
Mm-hmm. I think there was a Globe and Mail article recently saying that 40% of people in the last year had worked while sick. And of course, it was the people that had precarious employment, the minorities, people that really were underprivileged and needed to put, food on the table, pay the rent and whatnot. So this is the danger with this.
And of course, on December 31st, they're going to be lifting the rent freeze for people. So, people are going to be even in more precarious situations. We know that our housing crisis here is ongoing. And that's just going to mean that there's going to be more pressure for people to return to work at that 6-day mark, regardless of whether or not they are still feeling sick or not.
Right. And before, they may have been protected from losing their job for 7 days or 10 days. And now it's going to be, do I lose my job and not be able to pay rent and pay for groceries? Like, again, we need to be thinking about the most vulnerable that society has made vulnerable and continue to.
Any last comments before we finish up for today?
Yeah, I would say, if I think about what are my greatest fear, so Omicron is going to basically amplify everything that we have not done well with managing the pandemic up to now. So we haven't done a good job uniformizing the vaccination across the different regions. We saw what happened with the North being overwhelmed because we hadn't really been proactive at reaching out to people that were vaccine hesitant. We haven't addressed ventilation, air filtration in congregate setting, be it schools, be it long-term care. And we've had outbreaks in hospital. So Omicron, which is much more rapidly transmissible, evades vaccination is just going to amplify all of that. And it was Tedros of the WHO who says you have to bolster every single layer, use them all, and use them well all the time. And in this province, BC has refused to acknowledge that the virus is spread through aerosol. And therefore, that is our biggest blind spot. Plus, we've also haven't addressed the third dose ramp up, given that Omicron has changed the game. So we are very vulnerable right now.
Thanks, Lynn. Jen, any last comments from you?
Yes, I would like to address the fact that public health keeps saying that there's low transmission in schools, and they use that as a way of saying, well, we don't need to add those extra layers of protection. However, that is not what we have seen in reality. There are lots of families that have reported to Safe Schools Coalition BC that there were cases in their class and no notifications went out. Even a whole class is isolated, yet only a day or two ends up on the website when they know that transmission was going on over a couple of weeks. So the whole idea that transmission is low when it comes to schools has been debunked in lots of other places around the world, in lots of studies around the world. And the fact that BC still continues to say this when we know that in reality it's been happening, it's just not been reported. And so I would like to say that schools do need to have those layers of protection. If you aren't going to put those layers of protection, we are going to see a lot of transmission happening and a lot of families affected, which could have been avoided. And that was happening with Delta. And with Omicron, it's going to be so much worse. So I think that has to be something that needs to be acknowledged and addressed right away.
Great points there, Jen. Thanks so much. Amy.
I'm just reflecting on this year and thinking, when I started advocating 2 years ago, it was because of my precariously employed patients who are essential workers in Calgary who were affected by meatpacking and food industry safety. Fast forward 2 years, and it's actually pretty disappointing that we're still banging the equity drum so loudly and not really having a stick, because we're calling for a circuit breaker not because we want to, but because we're at that point now, because it can't be prevented anymore. But really, again, it's about trying to help those that society doesn't take care of properly. If we have a circuit breaker, we can allow more people to access federal supports, but we also can help individual small businesses, but also help their precariously employed employees and essential workers. So this is really, again, about making it so that the majority and the biggest number of British Columbians can be helped through this, and not putting it on the individual person or business to make those decisions where those workers may not actually have agency to speak up for themselves.
Absolutely. Thanks so much, Amy, for that. Last comment from myself. Looking into 2022, it is New Year's Eve today. I do think that we can get beyond this pandemic. And in order to do that, we really need to reject this idea of living with the virus. We've been living with the virus for the last 6 months. We've had a devastating Delta wave. We are now going into an even more devastating Omicron wave. That tactic is not working. But we actually have the tools now to be able to hugely control this virus and move beyond this pandemic. And that means going beyond vaccination. There is a great quote from Dr. Satoshi Akima that in a cholera epidemic, you would tell people that it's fine to keep drinking fecally contaminated drinking water as long as they're vaccinated. So why are we doing the same thing with an airborne virus? We have been successful in the past in combating waterborne diseases by treating our water. Of course, I'm sure certain First Nation communities would balk a little bit at that. We have managed with foodborne diseases to implement food handling standards, and now it's time to put what we need in place to deal with an airborne pathogen. It can be done. We know what to do. It's just a question of having the political will and leadership to be able to do that. So that's what I'm hoping for 2022. Thank you so much for joining us today and for questions. We'll be back. Thanks, everybody.
Happy New Year.